If you've been told to just eat healthier for your circulation, here's the problem. That advice is too vague to actually change anything in your legs. Most people with diabetes hear the same short list: walk more, cut sugar, wear compression socks. All useful. None of it targets the specific mechanism that's narrowing blood flow to your feet in the first place. But there's one food, backed by real vascular research, that works on that mechanism directly. It's not a supplement, it's not expensive, and most people have walked past it in the produce aisle their entire life without knowing what it actually does. Here's why the generic advice has a ceiling. Poor leg circulation in diabetes isn't just bad luck with blood vessels. High blood sugar physically damages the lining of your arteries over time, a thin layer called the endothelium. That layer's job is to produce nitric oxide, the molecule that signals your blood vessels to relax and widen. When the endothelium is damaged, nitric oxide production drops. Less nitric oxide means tighter, stiffer vessels. Tighter vessels mean less blood reaching your calves, feet, and toes, which is exactly where diabetics feel it first, as coldness, numbness, cramping, or slow healing cuts. You can walk every day and eat clean in the general sense, and still not be addressing that specific chemical shortfall. Cutting sugar removes a source of ongoing damage, which matters. But it doesn't rebuild what's already been depleted. That's the gap most advice leaves open. Think about it this way. If a pipe is slowly getting narrower from the inside, telling someone to just stop putting more debris in it is correct, but it doesn't do anything to widen the pipe back out. Most circulation advice stops at the stop adding debris step. What we're covering today is the part that actually widens things back out. So the real lever isn't just eating less of the bad stuff. It's actively feeding your body the raw material it needs to rebuild nitric oxide production from the inside. There's a specific class of food compound that does exactly that: dietary nitrates, and the response is dose-dependent. That means the more consistently you get an effective, correctly sized amount, the more measurable the change in blood flow. Not a huge amount, a specific amount, which we'll get to. This matters more than it sounds like it should. Poor circulation in the legs isn't just cold feet or tired calves at the end of the day. Left unmanaged over years, it's the pathway to peripheral artery disease, arteries in the legs narrowing the same way they can in the heart. From there, it can progress to slow healing wounds, ulcers that won't close no matter what's applied to them, infections that are hard to catch early because nerve damage dulls the pain signal, and in the most advanced cases, amputation. Vascular surgeons see this exact progression constantly in diabetic patients. It's one of the most common reasons diabetics end up in a vascular clinic in the first place. Warning signs worth taking seriously enough to call your doctor include leg or foot pain that shows up at rest, especially at night, coldness in one foot compared to the other, and any wound on the leg or foot that isn't visibly healing within a couple of weeks. The frustrating part is that a meaningful piece of this whole progression is preventable with changes that cost almost nothing. This isn't a cosmetic issue. It's a protect your legs for the next 20 years issue, and it's worth treating with that level of seriousness. So here's exactly what we're covering. 1. Food. 3 separate mechanisms by which it improves circulation specifically in diabetics, not just in the general population. Then the exercise piece that multiplies the effect. Because food and movement act on the very same biological pathway together, not 2 separate strategies. Research on this exact food, at a realistic daily amount, has shown measurable changes in blood flow and vascular markers in as little as 8 weeks. No extreme diet changes, no products to buy. Let's get into it. Everything in this video is drawn from published vascular and diabetes research, randomized trials, clinical reviews, and guidance published by vascular surgery clinics and major diabetes associations. This channel exists to translate that research into something actually usable, without the hype. As always, this is educational, not personalized medical advice. Talk to your doctor before making major dietary changes, especially if you take blood pressure medication or blood thinners. We'll explain exactly why that matters later on. The food is beets. Not a supplement, not an extract pulled out of it and put in a capsule the actual vegetable, or its juice. It works through 3 separate mechanisms. Mechanism 1, nitric oxide production, the vessel widening effect. Mechanism 2, antioxidant protection of the vessel wall itself. Mechanism 3, how the dose interacts with your blood sugar, and this is the part almost every other video on this topic skips entirely, even though if you're diabetic, it's arguably the most important one. Mechanism 1, nitric oxide production. Let's start with the biology, because the recommendation only makes sense once you understand the mechanism behind it. Beets are one of the most concentrated food sources of inorganic nitrate of any common vegetable. When you eat them, your body converts that nitrate into nitrite and then into nitric oxide, using bacteria on your tongue and in your gut as part of that conversion chain. Nitric oxide is the exact same molecule your blood vessels naturally produce on their own to relax and widen. Picture unclenching a fist that's been closed for years. That's what's happening inside the vessel wall. Wider vessels mean more blood physically able to reach your legs and feet, where diabetic circulation problems concentrate. This isn't a theory pulled from a wellness blog. Randomized, placebo-controlled crossover trials have measured this directly, comparing real nitrate-rich beetroot juice against a nitrate-stripped placebo that tastes identical, so the effect isn't just belief or expectation. That research has shown consistent reductions in blood pressure and measurable improvements in how well blood vessels dilate, using doses in the range of 70 to 140 milliliters, roughly a quarter to a half cup of juice. In research specifically involving people with type 2 diabetes, eating about 100 grams of raw beetroot a day, around 3/4 of a cup, chopped for 8 weeks, produced measurable metabolic improvements, even with the rest of the diet held constant. That's lever A, beet juice, in that small, specific serving, not a large glass. Lever B, if juice isn't practical for you, the whole vegetable, roasted, boiled, or shredded raw into a salad, works through the same nitrate pathway. You get slightly less concentrated nitrate per bite than the juice, but you gain fiber, which matters for the third mechanism we'll cover in a minute. You might be thinking, don't I get nitric oxide from other foods too? A little, yes, but few vegetables concentrate dietary nitrate the way beets do, which is exactly why they show up repeatedly in circulation-focused clinical research rather than, say, broccoli or carrots. Mechanism 2, antioxidant vessel protection. Nitric oxide gets you the open the vessel effect. But there's a second mechanism running alongside it, and it's the one that protects the gains you're making from the first. Beets get their deep red color from compounds called betalains, and betalains are potent antioxidants. Here's why that specifically matters if you're diabetic. High blood sugar generates ongoing oxidative stress, which is essentially chemical wear and tear on the same endothelial lining that produces nitric oxide in the first place. So it isn't only about producing more nitric oxide, it's about protecting the tissue that manufactures it from continuing to take damage while you're doing the work to improve it. Objection you might have here: I already eat a lot of colorful vegetables. Do I still need this specifically? Fair question. The antioxidant and circulation combination does show up in other foods. Dark leafy greens like spinach and kale carry their own dietary nitrates on top of antioxidants. Berries are rich in a different protective compound class called flavonoids. Citrus fruit supports vessel function through vitamin C, which helps blood move more freely through narrowed pathways. And fatty fish like salmon, along with walnuts and flaxseed, bring omega-3 fatty acids into the picture, which work through yet another pathway to support healthy blood pressure and vessel flexibility. Those are all legitimate runner-up foods, and rotating them in adds variety and covers nutritional bases. Beets don't touch on their own omega-3s in particular are worth eating regardless of whether you're focused on beets. But none of them combine concentrated dietary nitrate and concentrated antioxidant protection in a single food the way beets do. That dual mechanism, in one inexpensive vegetable, is exactly why beets sit at the top of this list rather than being just one item among many. Mechanism 3. Dose and blood sugar. Now here's the part almost nobody covers. And if you're diabetic. It's the most important mechanism of the three: dose control. Beets are not a zero-sugar food, and pretending otherwise would be irresponsible advice for this specific audience. A typical 100-gram serving of cooked beetroot can raise blood glucose by roughly 30 to 50 milligrams per deciliter in some people with diabetes. A full cup of beet juice can carry around 16 grams of natural sugar, about 4 teaspoons, straight into your bloodstream in liquid form, which spikes faster than the same sugar eaten as a whole vegetable. That's real, and it's exactly why more is better does not apply here the way it might with a vegetable that's mostly water and fiber. The studies that show real circulation benefits use small, specific amounts, not large servings that quarter to half cup of juice, or about 100 grams of the whole vegetable. The practical fix is straightforward. Keep your portion inside that tested range and pair it with protein or healthy fat, like a handful of walnuts or a piece of grilled fish, which slows how quickly the natural sugar reaches your bloodstream. Testing your blood sugar about 2 hours after eating beets, the first few times you try it, is the easiest way to learn your own personal response before folding it into a regular routine. That's the food piece 3 mechanisms. 1 hero food, dosed deliberately. But nitric oxide and blood flow don't respond only to what you eat. They respond even more powerfully to movement. So here's the multiplier that makes everything above work harder than it would on its own. Vascular researchers studying peripheral artery disease, specifically in diabetics, have tested calf muscle exercise and structured walking programs. Because contracting the muscles in your lower legs is one of the most direct physical ways to pull blood into the exact region where circulation tends to fail first. Clinical exercise trials for this population have looked specifically at calf muscle blood flow and energy supply, and at how a structured walking and calf exercise program changes that over time compared to no structured activity at all. Here's the detail that surprises most people. For type 2 diabetics specifically, how often you move throughout the day appears to matter more than how long any single session lasts. Research comparing exercise patterns found that short, frequent activity, as little as 3 minutes of movement every 30 minutes, produced better improvements in blood flow and vessel dilation than one longer, uninterrupted workout, or no activity at all. That doesn't mean skip the real workout. It means stacking both approaches, a base of roughly 30 minutes of cardio-type movement most days of the week, plus short leg focused breaks scattered through the day if you spend a lot of time sitting. Walking is the simplest option because it directly works the calf muscles that physically pump blood back up your legs against gravity. If walking is limited for you because of pain or mobility, seated leg raises, ankle flexes, and calf raises target the same underlying mechanism without needing to leave your chair. Let's make this simple enough to actually start today, not just something you nod along to and forget. For the food, aim for roughly 100 grams of beets, or up to half a cup of beet juice, 3 to 5 times a week, not multiple times in a single day. Roast them with olive oil. Shred raw beet into a slaw. Blend a small amount into a smoothie alongside a protein source, or add chopped beets to a salad. Pair it with something containing protein or fat so your blood sugar response stays gentler than it would eating beets alone. A few safety notes worth taking seriously rather than skipping past. If you're on blood pressure medication, layering a natural vasodilator on top of it can occasionally push your blood pressure lower than intended, so mention this change to your doctor before making it a habit. If you have a history of kidney stones, beets are high in oxalates, so check with your doctor first. And if you're on blood thinners, any consistent change affecting circulation and blood pressure is worth a quick conversation with your prescribing physician, not because it's dangerous on its own, but because your existing dose may need to be reassessed alongside it. For the movement piece, set a timer for a 3-minute break every half hour if you're desk-bound most of the day, and build steadily toward 30 minutes of walking most days, broken into shorter chunks if a single long stretch is hard on your feet right now. 10 minutes in the morning, 10 after lunch, 10 in the evening counts just as much as one unbroken 30-minute walk for this specific goal. Consistency across the day matters more than doing it all at once. And one more practical note, If you're already checking your feet daily as part of your diabetes routine, this is a good moment to also start noticing temperature and color changes in your legs and feet over the coming weeks. You don't need special equipment, just paying attention to whether your feet feel warmer, look less pale, or recover color faster after pressing on the skin is a reasonable, informal way to notice change alongside whatever your doctor is tracking at your regular checkups. So back to where we started. Just eat healthier was never wrong. Exactly, it was just never specific enough to target the actual mechanism failing inside diabetic circulation. Nitric oxide production, antioxidant protection of the vessel wall, and a controlled blood sugar-aware dose. That's what turns a vague piece of advice into something your legs can actually feel over the coming weeks. One food, 3 real mechanisms, and a movement pattern that multiplies all 3 at once. Start small, track how you personally respond, and loop your doctor in on any changes, especially anything involving blood pressure or blood-thinning medication. If this helped you understand your circulation a little more clearly than the usual generic advice does, that's exactly what this channel is here for. Take care of those legs.